Hello, guys. Welcome to Nursing Made Easy, a platform where you get easy but comprehensive nursing presentations. If you want me to make any presentation on a specific topic, please let me know via inbox or comment section below. I was discussing about communicable diseases. In my last video, I have discussed about chickenpox. Now, the second communicable disease we are going to discuss today is typhoid fever. So, guys, typhoid fever is also called as enteric fever because it is the disease of digestive system, mainly affecting the intestines. Definition of typhoid fever is as an acute illness of digestive system characterized by fever, abdominal pain, loss of appetite, constipation or diarrhea. It is transmitted through contaminated food, water, flies, soil or unhygienic hands and fingers. So guys, I have tried to made a definition, a comprehensive definition, including both the sign symptoms and mode of transmission of typhoid fever. Now, what is the causative agent of typhoid fever? Basically, Salmonella typhi is the causative agent of typhoid fever. Let's have a brief overview of pathogenesis of Salmonella typhi. Basically, it is a disease which is spread through fecal-oral route. So, when a person ingested a contaminated food or water, that Salmonella typhi invades in small intestine and enter the bloodstream. And after that it travels to the liver, spleen and bone marrow, where it multiply and re-enter the bloodstream. The incubation period for typhoid fever is usually 10 to 14 days. Period of communicability, it usually from 1 week after the onset of symptoms through convulsions and for a variable period thereafter. It varies from individual to individual. For the definition of incubation period and period of communicability, guys, you can check my video of chickenpox. Now, what are the mode of transmission of typhoid fever? As I mentioned earlier, it is a disease of digestive system which is transmitted through fecal-oral route. So, feces and urine from cases and carriers are contain Salmonella typhi, which is spread through water, soil, flies and fingers to the mouth of a healthy person via raw or cooked foods as well. Now, what are the sign symptoms of typhoid fever? Typhoid fever includes headache, pain in the abdomen, nausea and vomiting, loss of appetite, muscle pain, tiredness, irregular fever. Basically, in typhoid fever, the fever is very high. A person suffered with hyperpyrexia, a fever of about 103 to 104 Fahrenheit. Lab tests of typhoid fever includes blood cultures, CBC. In CBC reports, there is increased number of white blood cells. Stool cultures for the positive Salmonella typhi several days after the ingestion of bacteria. Vidal test is most commonly used test for the diagnosis of bacteria causing typhoid fever is mixed with a serum containing specific antibodies obtained from an infected individual. Now, the most important slide is how to prevent the disease. Here are the few points by following which a person can avoid typhoid fever. The first one is wash hands thoroughly after using toilet and before handling food. Eat only thoroughly cooked food. Drink only boiled or bottled water. Avoid restaurants with poor cleanliness. Food handlers are required to get vaccinated. Now, what is the treatment of typhoid fever? Basically, it includes ciprofloxacin, per oral. Adult dose is 500 milligram orally every 12 hours for 10 days. Or ceftriaxone, that is injection rocephin, IV route, adult dose 2 gram IV every 24 hours. Thank you guys for watching typhoid fever.